Rhinoplasty is a procedure to change the appearance of your nose. Patients that would be good candidates for this is someone who didn't like the look of their nose, or maybe you can't breathe through your nose, maybe you've injured your nose in the past. All these would be good patients. What you have to understand with rhinoplasty is the limitations of it and what can and can't be done with surgery to change the appearance of your nose. People that would be bad candidates for surgery are people that have medical problems, maybe they're on blood thinners, or people that have unrealistic expectations with regards to the surgery. So surgery can't make you look like another person, and sometimes there are limitations with how much your nose can change. So realistic expectations are very important when thinking about undergoing a rhinoplasty. What you can expect with a rhinoplasty, it is a surgical procedure. It's generally done under general anesthesia, so you don't feel a thing. There's no pain associated with the surgery at all. Afterwards, people do experience some pain, although it's not very severe. Usually people take a day or two of pain medicine, but usually that's about it. What people mostly complain about after rhinoplasty surgery is that their nose is very congested. We tell people you feel like you have a bad cold for about a week. After that period of time, after 1 week, we'll see you, we'll take bandages, casts off your nose depending on what exactly you had done with the rhinoplasty, and usually you can breathe better, you feel better after that 1 week period of time. People always ask, how long does it take to heal from a rhinoplasty? That's sort of a loaded question because after about that week, most of the sutures are out, most of the swelling is gone, and you do have a different appearance to your nose, but it really does take 6 months to 1 year for you to heal completely from the rhinoplasty. This is sort of complicated on why this happens, but it has to do with the small amount of edema or swelling that persists in your nose. There's really no way to make that go away really fast, and it does take about 6 months to a year to go down. And what I describe to my patients is it's almost like a saran wrap has to shrink down around the cartilages that we're changing underneath the skin. So it has to do with the skin contracting, the edema coming out, and your final appearance you'll see in about 6 months to a year from a rhinoplasty. So as far as risks and benefits of rhinoplasty, we did talk about the benefits being that you have a better appearance to your nose and that you can breathe better, but as with any surgical procedure, you need to be aware of the risks as well. The most common short-term risks from rhinoplasty are basically bleeding and infection, and that can happen in anywhere up to 5 to 10% of people. Usually the bleeding isn't severe enough where we'll have to do anything about it, but certainly it does happen at times, and it's a bit unpredictable as to who that happens to. At Jefferson, we're very equipped to deal with this kind of thing, and if you do have a complication short-term after surgery, we will be very attentive and deal with that immediately. As far as long-term risks of rhinoplasty, probably the most common thing that happens is asymmetries or things about the appearance of your nose that you might not necessarily love. And that happens, and the reasons why that happens is multifactorial, but the wound healing that happens after rhinoplasty is sometimes unpredictable. There are sometimes small things that happen with the surgery. At Jefferson, and the physicians that perform rhinoplasty at Jefferson are committed to making you happy though. So most of the small things that do happen after rhinoplasty surgery, if you do have asymmetries afterwards, we work very hard to correct.